So overall, I mentioned that I cover EDU. So when we talk about education with Google Cloud, we really support three main segments. So we've got higher ed. We've got a big, again, growing team across all three segments. Within higher ed, there's diversity there as well, where we cover universities, colleges, as well as academic medical centers. So there's some topics here where we'll actually have some overlap with Manish, the next presenter, on the HCLS side and the solutions that we'll describe in that segment. Edtech is a big and growing focus for us as well. This is really overlap with SMB and digital natives, where we support edtech startups, publishers, LMS solutions. And then the last is K-12, and that's really where Kyle focuses. We'll also be spending the majority of kind of our solution time and our enablement on K-12. This is really a channel-led motion for us. And the big draw here is, as you all know, we've got big Chromebook footprint, a lot of Google brand leverage in the classroom. And so really, I'd be interested in learning more about the work that you're doing with Chromebook in classrooms as well. So there's a lot of plays and sales plays that we will discuss that really leverage kind of upselling and the kind of footprint that we already have in the classroom. In terms of the growth I mentioned, just for any of you who do work and focus on education, it's just, a really stressful time for schools with a lot of challenges, whether we're talking about maintaining competitiveness, especially in higher ed, attracting and maintaining students, providing quality hybrid and remote learning, and especially at scale for larger districts, total cost of ownership and considering, cost optimization, security. I know we just heard a lot about security, so I won't go in detail on that front, but really security being top of mind. And then really a key area for us in higher ed is research. Google Cloud is a big research cloud. We have a lot of researchers using Google Cloud for really innovative solutions. In terms of the kind of why GCP, we've got solutions that we'll go through and some of the technology that I know you've heard a lot about today. And when we talk about education, which is under public sector, we have some interesting pricing models and discounting that, again, when we get kind of further down the road, we'll go through those. But there's some structures that we're really able to leverage being under the public sector umbrella. So if you want to flip to the next slide, Kyle will go through K-12 first.
Yeah, let me walk through a couple of these here. I tried to frame this slide into the things that are more off the shelf, fully baked, ready to go, and then some of the other solutions that are ready to go but involve a bit more of a deep conversation with the customer to really understand where they're coming from to make sure we're bringing the right solution. I also, as I walk through these, I'm going to try to frame these in terms of like what problem we're trying to solve at Google when we're coming to these districts. So the first spot on my slide is for virtual apps. This is something that definitely exploded a lot during the pandemic, but has kind of sustained even as we transition back into the classroom. The big problem we're trying to solve is all these K-12 districts are using all kinds of Chromebooks and Workspace. And as they're using their Chromebooks, there are some applications that won't run on it, right? You can't run things like Photoshop, SolidWorks, AutoCAD, even some basic Microsoft Office stuff. You can't run those native programs on the Chromebooks. Now, there are some workarounds, but we have a lot of CTE classes in particular who are saying, hey, my students are trying to get certified in like the Adobe Creative Suite, or they're trying to go through, an accreditation program for architecture. Like they need this software. The old way of solving this is basically by throwing money at the problem, getting a lot of high-end hardware, building a computer lab, having a secondary device for teachers and students. But what we found is that if you can actually like really remove all that friction and just deliver the applications that students need through the cloud, that makes it a lot easier. This way, whatever device the student has, whether it's a low-end Chromebook or a high-end MacBook, they're still able to get exactly what they need, all delivered from the cloud, and it's a little bit more secure doing things that way as well. I highlighted a few of the partners that I work with on the bottom here. Citrix is a big one we work with in the bigger districts. We also work with Nutanix, Cameo. There's a couple big players out there. There's this other need I've seen over the last probably about 3 years or so working in K-12 for translations at scale. Many districts are required by law to provide translations for their documents for students, teachers, staff, parents, all of the above. And the old way of solving this is basically by having translators on staff, which, they do a great job. Those are highly accurate translations. But when you really get down to the brass tacks, it takes weeks and weeks on end to provide these translations. A lot of teachers have tried to step up and solve it themselves by using like translate.google.com or just using what's built into Google Docs. But when you have like, 20, 30 documents, you need different languages for each of those. That teacher's sitting there and copying and pasting it all day long to get those results. And on top of that, what we have on our website is not as powerful or robust as what we have in the cloud. So Google basically built a front end for this in-house to basically allow teachers, staff, parents to basically drag and drop any type of document, drop it into this front end. It's very similar to Google Drive. And in a few seconds, it'll export a fully translated version of the document while maintaining formatting. So this is a great way to basically, help build some equity within these districts, help kind of, bridge that communication gap that sometimes happens between parents, teachers, and students, and also does it in a really easy way. Before we had districts trying to basically build this themselves, they don't have the technical capacity to do that. We basically built the front end, got them closer to that magic, and just made it really easy to adopt. The best thing is this is all wrapped up in a flat rate GCP subscription. So we're able to estimate the cost, charge the customer one flat rate. There's no surprise billing for the whole year. So both of these solutions are ready to go. We're actively selling them. We're seeing a lot of success with districts. We got case studies back it up. These are two of our primary go-to solutions. On the bottom here, I have three others that I call strategic solutions because they do involve a bit more of a conversation. I can say with ease that every district I talk to always brings up analytics. They all mean something different by it, but they do always bring it up. Some of them mean they want a basic dashboard. I have other districts who are going all the way down this road of like machine learning and AI to figure out, where students' passions and aptitudes collide. In between all those different flavors of analytics that are happening, we have many service partners who have a pretty robust business built around this that can partner up with Ingram and other teams to basically help deliver some of these solutions. I mentioned some of those partners at the bottom there. I hopped on a bit at the end of the last session. I know security was touched on a lot, so I won't spend too much time there. I'll just mention that we do have a few solutions that are SaaS applications or out-of-the-box solutions like Chronicle, like Palo Alto Networks, that we see a lot of districts adopting. It does involve a bit more of a deeper conversation to figure out what's the right fit for them based on where they're at in their security journey. But we do have a lot of strong offerings, and it is always top of mind in K-12 districts. How can they be more secure? How can they protect themselves against ransomware attacks? Real quickly on this last one, backup infrastructure. This is, I look at this as a commodity. Every district needs it. Most districts have it. We have some compelling solutions where, again, we can look at offering the flat rate pricing to really help districts, look at their security strategy, implement a backup solution. So if they do get hit by ransomware, there's always a recovery point. Joanne, I'm sure you'll talk about this, but if you only have like 10 seconds of capacity to like focus on anything in this presentation, the biggest thing I want you to take away is that our number one Google Cloud differentiator is that ability to offer flat rate pricing within public sector. It does depend on the workload. It does need to be a public sector customer, but we are able to extend it to our customers. And for me, that's made my sales conversations just so much easier, so much easier. All right, with that, I'm going to pass the baton over to Joanna to talk through some of the higher education solutions.
Perfect. I know we're really behind on time, and so I'm just going to be very quick. Higher ed, just three sort of main constituents that I'll break these down into. One being central IT, two being research and academic research, and then three, student success, teaching and learning. We've talked about infrastructure solutions. I think Kyle mentioned, some of these are more commoditized. I would say GCVE, Google Cloud VMware Engine, it might be one that's interesting for this group, especially if you do work with VMware already. Hybrid infrastructure is something that's really important and top of mind for education institutions. Security, I know we've talked about security a lot. That's a foundational one. Overall, just the kind of security features of Google Cloud. I know Manish will likely talk about HIPAA compliance. So that's really important on the academic research side as well as our security solutions. So for example, BeyondCorp. When we're talking academic research, again, GCP is very big cloud for academic research. High performance computing, for example, genomics workloads. The last bit here, student success and classroom of the future. This is really an interesting area for us, and that's where we've been seeing more adoption. There's a lot of services in this area as well for partners that really have, are looking to get more into services. This is really an end-to-end engagement that we have, ranging from helping schools that are trying to do more marketing optimization and outreach for students, targeting students who are more likely to enroll, optimizing financial aid, all the way through engaging students, leveraging, for example, chatbots and CC AI throughout the student life cycle while they're at school. So for example, supporting students when they have questions about their degree program, even supporting within content, providing better ML and AI recommendations for students based on what they're learning, highlighting students who might be at risk for dropping out or falling behind, all the way through alumni engagement. Kyle already talked about virtual desktop or VDI as a service as well. And then the last piece that we mentioned here on the teaching and learning side is Workspace. I'm sure we've covered Workspace a bit earlier in the day, but we really have a lot of schools, both K-12 and higher ed, using Google Workspace, and that's really a nice starting point as well for conversations to get deeper into cloud. So I know I went really quickly. We have some resources for you. I would be really eager to follow up, but I do want to make sure that we get to the next presenter, and I believe, Manish, that's you.
Thank you. So for all, this is Manish. I'm a senior principal at Healthcare and Life Sciences of Google Cloud. Fun fact, right? So I'll skip that part because I'm not that fun as Kyle. I cannot stand on my head. But um, what I really wanted to talk to this group about was that what Google Cloud has to offer from a healthcare services perspective. So if you could go to the next, right? I mean, I think what we are really aiming to is digitally transform healthcare. We all know healthcare is a little bit behind on technology. We all know that healthcare is traditionally not on the forefront of technology, but this is what the mission of Google Health Cloud is. Next slide, please. We are committed to health, and we are committed to making sure that there are right level of investments, and we are committed to make sure that we deliver and make sure we change the industry as we invest in this capability. So as you can see, we are continuously investing in healthcare as Alphabet as a company. We are building products which are healthcare specific. We recently got Fitbit, so we are trying to get into digitally monitoring patients. We are making sure that Verily, which is another group which is also looking into life sciences and more into how do we really use the power of computing and apply that to healthcare. So these are some of our recent investments. I think this list has gone beyond what I'm showing here, but Alphabet is and Google is committed to healthcare. That's the point in this slide. Please go to the next one. Why Google for health, right? I mean, this is 5 bullets here. Uh, in healthcare, we cannot move any further unless we are compliant. We have all the security protocols. So that's a primary, and I'm sure throughout the day you're hearing about security and compliance, which is on top of mind for healthcare customers as well as for us. So we have some differentiating factors on healthcare security and compliance. Technology, yes, we will talk about that. We have built healthcare specific AI models. I'll talk about some of the customers, how they use those models and really deliver, I would say, care at its highest level. And then we are continuously building this expertise. So it's not that this is something which is new, but we have a huge expertise in healthcare and life sciences. I talked about some of our partners. I'll talk more about that. Please go to the next one. Let's talk about security and compliance, right? I mean, I think there's this ownership of data. Let's get it very clear. Google is not storing any of the data when it comes to healthcare. The data belongs to the customer, belongs to the patient, and they own the data. Google will never own the data of our customer. And then we have security protocols and capabilities to make sure that the data belongs to customer or belongs to patient with all the compliance and all the permissions we have from the patient. You control the location of data, right? In healthcare and life science, especially payer provider industry, it's very important that the data does not leave a certain location. And with Google Cloud, as you can imagine, we have data centers all over the world to get the scalability. but still you can manage all the services so that the data stays at the location you want to. Access the data. If you heard the previous sections about security, you can control all kind of accesses at the column level, at the row level of patients' medical records and their privacies. Compliance, we comply to all the standards. The next slide will show you all the standards we comply to. Please go to the next one. So yes, we are complying to every possible standard out in the world. If your customers are in US based, we have all kind of HIPAA, high trust partnerships and standards to comply with. Europe, GDPR, Asia, and Japan, we comply to all standards, and we have customers all over the world who are not only hosting Google Cloud as their primary hub for their data, but also doing analytics on their patient data using our platforms. Let's go to the next one. I will talk about three use cases which became very evident during COVID time. As we all know, things came to standstill. Patient didn't wanted to go to hospitals or their doctor's office. So we'll talk about a little bit about patient experiences, how we transform that. The second use case I'm going to talk about is delivery, right? How we use data and analytics and AI to really drive the delivery of healthcare. And life sciences and are really behind in drug discovery, although we all are blessed that some of the life sciences company came up with the vaccines in less than a year. But traditionally, it takes them 12 to 15 years to come up with a medicine. And the most challenging part is how do you get the FDA approval? Yes, COVID vaccine was fast tracked, but still there are a lot of conditions where even with the fast track, it takes 10 years to get a medicine approved in the market. So these are three use cases. I'll talk a little bit about how Google powered these use cases and how we were able to help our customers and patients ultimately. Please go to the next one. So digital patient experience, as I said, just talked about it, right? I mean, the digital front door, how do you access healthcare is becoming very, very critical. And I think it really highlighted during the time of COVID that patient didn't wanted to go to hospitals or doctor's office. How do you really make sure that they get the same experience while they're visiting the patient or the physician online? And we were behind powering that whole experience in a lot of cases. There was Cambridge Health Alliances as an example where we almost had 1,000 telehealth sessions per day. And this is prime during the COVID times. And these things were built very quickly and very fast. Virtual care is here to stay. It is not only going to augment, but also complement the care delivered at hospitals or doctor's office. So it's here to stay. We see a tremendous growth in this area. Again, these solutions are as a platform as a service or even service offering, which you can partner with Google and then deliver this capability. Next use case, if you just click next, yeah. A very frustrating experience of the patients are when they're waiting on the whole lines. Here you're sick or your child is sick, going through a 102-degree fever, and you're waiting online to either get a appointment with your physician or talking to a nurse. We really augmented this with the virtual agents. So you can answer a few questions online and really get to the right nurse at the right time or the right physician very quickly. So a whole AI model which complemented the virtual care was built around that so that not only you get the right person with your right symptoms. And again, COVID, this kind of really became very evident that people were nervous about their symptoms. They were not sure what doctor they should talk to. And this, we built it for University of Pennsylvania, really reduced their wait times by, I don't know, 100% or something, but very, very powerful solution which was built for them using a combination of telehealth in addition to AI and ML. And as I said, right, I mean, this is a platform which is continue to see growth, not only during COVID times, but for future patients. What we are seeing is trying to complement their care with the visits as well as virtual visits. Let's go to the next slide. I will talk about a different use case. Oh, and then before we go to the next use case, this is some of the investments and partnerships we've done in terms of telehealth, right? So Amwell is our partner for telehealth, and there are some other partnerships we have done. Nest, as you know, is a remote remote capability. How do you monitor that? We are making more investments in remote monitoring and uh, things like Fitbit, how we can monitor patients remotely. So that's where the area we are really investing in and continue to invest. Next slide, please. Delivery. I'll talk few use cases about how we have augmented the delivery or implemented certain solutions which really makes a difference at the point of delivery. If you click the next button, I think it shows up. Yeah. As we all know in healthcare, interoperability is a huge challenge. We have multiple electronic medical records systems implemented within the hospital. Even within the hospital, different departments will have a different versions of the electronic medical record system, Epic, Cerners. It's very hard to get the right set of information and get the longitudinal patient record together from all these different electronic medical record systems. And we have built solutions around that. So we have accelerators which can map your data from different systems. Again, huge capability when it comes to understanding patient health. Even if within a same hospital, if you go from one department to another department, usually there would be faxes, or usually if you're visiting a off site of a same hospital, they will do faxes of your patient records. And we are trying to really deep dive into this interoperability and make sure that we can build those patient longitudinal record, and then that we all can understand how important it would be when comes to a complete care of a patient. Click the next button. I won't go to deep dive, but again, similar holistic view of patients. And once you have the holistic view of the patient, right, then you can really build AI models and analytics on top of that to understand patient health. Of pre-diabetic getting into diabetic, if they're having eye symptoms, is it because of their diabetic condition? Now the physicians and the doctors can see, once they have the whole record of the patient, that if I'm going to an eye doctor, and if I don't have my diabetes record, they won't be able to correlate that. But if you have a holistic record, you can really dive deep into holistic care. And that's the idea behind bringing all these different scattered health records into one centralized data system, which we are really focused on. We are not going to be an exchange. Google had an attempt of building a EMR system. We are not going to do that. We strongly believe that the customer owns their records, and the customer or the hospital system payer or provider, they own the patient record. So we continue to build our platforms using that philosophy in mind, and with all the security protocols in mind. Go to the next one. This is a very different use case for healthcare and life sciences. If you click a couple of bullets, a couple of clicks over there, so it will just build. This we are talking about R&D in life sciences. As we talked about before, life sciences takes a very long time to discover a drug. And one of the key aspects of that is the whole clinical trials, and how do you really build a package for FDA to approve. It goes through multiple rounds. I worked in life sciences industry for a long time. It's very hard to get an FDA approval, and there would be multiple trials across the globe with very selected patient population or very wide patient population, and submitting that package can take years and years. It requires real world insights. So basically, not only running your clinical trials at locations, but it will also compare it with what if this was given to a real patient, and what will it happen to a real patient other than a trial patient. So a complex set of documents and data has to come together to give that for FDA approval. And we have built package solutions to make sure that there is we can not only capture real world data, but also combine multiple sets of data to prepare that package. Um, Here's in the second bullet when we talk about genomic insights, Broad Institute, a lot of high power computing required. I mean, if you think about the genomics, it's a very, very large data sets which you have to churn in a very quick time to get the right insight. Broad Institute, we saw almost 400% increase in their computational capability by using cloud, our health API, as well as our data powered by our computing powers. So a good example and good use case of how cloud computing can help churning large data sets and providing right insights at the right time. Um, the same set of challenges in life sciences in terms of scattered data, how we can solve those problems, massive computing power, which can help. And again, healthcare specific computing data, right? So it's not only just any data, but if you combine, let's say, census data, you combine healthcare data and want to try some analytics based on that, which we are seeing a lot of customers asking for. How does the social determinants of health makes it different in healthcare delivery? How do I really combine that factors and build my products for healthcare delivery? So we are seeing a lot of those type of high computing requirements, which Google can really power them and use the cloud power of cloud computing as well as build the healthcare specific APIs to power them. Next slide. These are some of the customer, which the list keeps on going. I have later on the slides, so I'm not going to go through all of them, but we have some um, specific examples of the customers who have used our power of Google Health as well as the cloud computing to really change the way they deliver health, change the way they understand health, and again, how do they apply those computing power as well as analytics to understand health better. So that's kind of list of our customers, which keeps on growing. These are our service partner, which we work very closely. I mean, as I said before, we are looking to partner. Again, the data belongs to the customer, data belongs to the patient, and we work with your clients and customers to make sure that all those protocols are followed. That's pretty much I have. We can take answers as a follow-up, but on the slide we have a couple of customer examples as well to help you make it better, understand better how we offer our capabilities in Google Health. Thank you.
Manish, thank you. Again, I would love to do some live Q&A, but I think in the interest of time, we're just going to keep moving ahead. We'll certainly pass along any questions that come up. But with that, I will turn it over to our last kind of vertical use case to Scott from Citrix to chat for a few minutes.
Thanks a lot. Appreciate that, everyone. So what is Citrix? Well, Citrix is one of the leading virtualization providers in the world. And 98% of the Fortune 500 utilize our Workspace solutions, which includes our flagship product, which is the virtual apps and desktops. Coincidentally enough, was just rebranded as Desktop as a Service. And what that does is it gives people access to all the apps and data they use in their everyday lives, access from anywhere, anytime, any device, anywhere that they really need to do work. And these days, work just isn't a place that you go. It's something that you do. And Citrix technology lets you define what that looks like. And when a customer has the freedom to choose their own work style, ultimately, they're going to be able to do their best work. So the market opportunity, most of our successful Citrix CSP partners, they're verticalized. I know we talked about healthcare and a few other verticals, and Citrix is not that different from that perspective. So we do see tremendous success with medical, legal, manufacturing, financial, and higher ed as well. But ultimately, any customer who has the need for some sort of a remote work or hybrid work strategy, it's going to be a fit. And when it comes to putting together that strategy, that's something that we would certainly be willing to do and help, from that perspective. So we talk about the GCP and Citrix together. So GCP and Citrix recently expanded their strategic partnership to deliver the future of hybrid work. And there's a brand new DaaS offering on Google Cloud. And what the service is going to do, it's going to leverage the Citrix management plane and the HDX protocol to enable the same seamless delivery of a virtualized application. And the apps and desktops on Google Cloud is now going to be the preferred virtual desktop provider of GCP, and GCP is now the strategic cloud partner for Citrix. And if you think about these areas, and I'm going to just go gloss over these. I'm not going to go too in depth, but the future of work means a new balancing IT act. So no matter what the work of an organization today, it's likely done as much in the office as it is out. And having access on mobile devices as much as traditional computers, I mean, it's pretty much a 50-50, scenario from that perspective, but much more through applications for core business activities. Collaboration with partners and customers is really impactful. And if you look at business disruption, that can ultimately impact an organization tremendously, and it could be of any size, from that standpoint. So what Citrix and Google do is they can offer the opportunity to ensure that operations can continue during these types of challenges. And ultimately, it's a plan to ensure that users can stay productive while maintaining control over access to all their corporate resources. And with Google and Citrix, it's easy to give employees the flexibility to work from wherever, whenever, keeping all their applications and data secure. Glossing over digital transformation, if you think about it, digital transformation can be truly effective if you embrace its potential and the potential to transform how work gets done. I would say that few business leaders today would dispute the fact that from an employee experience perspective, that doesn't matter. So having a good EX strategy, it can help to really reduce employee turnover, improve customer experiences, attract new talent, increase people's pride in the way that they do work. Simply put, happy employees are productive employees, and Citrix and Google certainly lend to that. Last but not least, talking about app delivery and security, you can't control the internet, but you can prevent bottlenecks from affecting app performance. And with GCP and Citrix, it's an opportunity to ensure a secure, optimal application experience anytime, anywhere.